Oh, good. There we are. So good morning once again. Welcome. This morning we have in our midst Migz. She will introduce herself shortly. Migz
Yes.
is a registered nurse, an NCLEX registered nurse, and she heads a program at the Aguinaldo Recruitment Agency in the Philippines. She's been training NCLEX nurses for God knows how many years, she will tell you. And she has been recruiting nurses from the Philippines to the United States for over 10 years now, 15 years plus. And therefore, she has experience in the area. Did I also say she's a nurse? Yes, I said that. She's a nurse and a registered nurse at that. This morning, Migz will take us, all of us, through an orientation on the NCLEX program, the NCLEX exams, training for the NCLEX, our training review program, and preparation and preparing you to take the NCLEX. Now, I know this morning I see a number of you who are not NCLEX students, but you're also CNA students. It is good you are here. Welcome all of you, because as we have explained to you, our CNA program will get you to the US, but whilst you get to the US, we'll prepare you to take the NCLEX in the US. So it is good you are here. You will see an overview of what the whole NCLEX program is and how you must approach the NCLEX program. So we welcome all of you. Migz, I have the honor to welcome you. Thank you very much for honoring this invitation. I know the day is ending in the Philippines. Probably it's past 5 p.m. there. Thank you very much for joining us. So,
Okay. Thank you so also, David. Thank you, everyone, for welcoming me.
yes,
Yeah.
thank you. So, Migz, if you are
Okay.
ready, please take over. Can you on
Yes.
your video camera so we can see you?
So let me check.
There you are.
Okay, here.
Better.
Yeah. Okay. So once again, good afternoon. So today, here in the Philippines is afternoon. So good morning to each and every one of you there. I know
Good
it's
morning.
morning in your place. So
Yes.
here in our place, it's afternoon. So it's almost 5 o'clock. Okay, and it's so early for you guys.
Yes.
Okay, so welcome everyone. So thank you also for welcoming me. So I'm, as David has mentioned earlier, so I'm a registered midwife. I'm a registered nurse here in our country in the Philippines. I'm already handling the NCLEX program for almost a decade. And I've been a dean also of some colleges of nursing here in the Philippines. So meaning since I started to become a nurse, I already in the academe. So I'm engaged in the academe, and but now, so I 10 years ago I started to conduct NCLEX review for nurses who wanted to work in the US. Okay, so I already disregard, the review for our local licensure here in the Philippines. So I focus more on NCLEX. So for now, so I was positioned as the training director for NCLEX review with Aguinaldo. So right now we have actually 5 batches, and we have some nurses who will be taking the NCLEX this month, May, June, until before December. So we have a lot of, actually it's almost, we have
Wow.
actually yeah, we have actually more than 70 nurses, so we'll be taking the licensure examination within this year. So under my care. So I hope you guys, you will focus on your review for you to pass the NCLEX so that you could work as a nurse in the US. Of course, you need to pass the NCLEX because you cannot be a nurse in the US without passing the NCLEX. Okay, so do I need to, or you will be the one, David, to tell them about the program so that I could, or is it the time to
Yes,
orient them about the program
yes,
and I will
it's the
just,
time to orient them about the program.
mhm. Okay, so we'll just reinforce. So after your orientation, David. Okay, so I'm so happy to see you all guys.
Mhm.
And we're about how many? So 40 plus participants.
Yes.
Okay. So it's your turn, David. So I'll just reinforce later after your discussion.
Okay, so
Okay.
thank you, Migz.
You're
So
welcome.
this morning, let me see, is Faustina here? Samira too, are you here? Hey, this my people.
Yes, Mr.
Okay, I hope you are paying attention and you are not, how do you
Yes,
call
sir,
it?
we are here. We are paying attention.
And you are not multitasking. You know multitasking, doing so many things at the same time. Okay, so there you are. Good. I'm happy you are properly seated and paying attention. Okay, so our NCLEX program, and I'm happy to inform you, we developed the content and the presentation together with Migz. Some of you had begun already. Faustina had begun already. Samira too has begun already. And a couple of you, if I don't mention your name, please forgive me. My gray hair is coming plenty, so I have a lot of things on my mind. I can't remember all your names.
It's just fine as long as all of them pass the NCLEX. Yeah.
Yeah. So those of you who have started already, you would have noticed the course structure structured this way. It is a weekly modular programs broken down into weekly modules. So week one has a number of subjects you need to cover. Week two also has a number of subjects, topics to cover. Faustina and the rest, you may have noticed there are a lot of tutorial videos. Now, you're not going to use the videos alone. You'll be using the videos in conjunction with the textbook. And you already have that textbook. That is the textbook we gave you from day one when you enrolled on our program, even before you took the assessment exams. You had those textbooks. I'm referring to the Sounders NCLEX Prep textbook. That is the official textbook for your NCLEX program. So the topics you see on the course page, which has been summarized in this table I'm sharing with you, covers completely the NCLEX program. Of course, subject to some additions, Migz will be adding along the line, which is the NCLEX next generation. As you may be aware, from April this year, the NCLEX has become much harder and much tougher with the introduction of the NCLEX Next Gen by the NCSBN. So there's a whole program on the NCLEX Next Gen. When you go to your electronic library where your textbook is, you'll also see a another book, test item for the NCLEX Next Gen. Okay, so we're going to cover all these topics in the next 12 weeks to 16 weeks maximum. 12 to 16 weeks maximum. You need to cover everything here. And Migz is going to talk about it. There are tests and assignments along the course you need to be taking. Each week, you're expected to take a minimum of 2 tests. A pre-test for the week and a post-test at the end of the week for each of the topics as is covered on the NCLEX program. And then when you are done with all the topics and all the tests and assignments, there are 4 predictor exams you'll be taking. The 4 predictor exams will enable us to see if you are ready to take the NCLEX and pass. Now, this is a tough and a rigorous program. And the reason is the exams is tough. We need to prepare you to take that tough exams and pass. When you prepare adequately, the exams becomes easier for you. Secondly, in our part of the world, and Migz, I know in the Philippines, you have the NCLEX exam center in the Philippines there. But
Yes, we have it.
Yes, we have it in the Philippines there. So it's easier. The cost in transporting and taking a student to the NCLEX center is not much.
Yeah.
But in our case here, the NCLEX exams can be taken in South Africa, which by flight is about 5 hours, 45 minutes. It cost us a minimum about $2,000. It cost us about $2,000 to transport an NCLEX candidate from Ghana to South Africa to take the exam.
Yeah.
And this covers transportation, the air ticket, accommodation, feeding, transportation, round trip air ticket. So for this reason, we are highly selective of who we admit on our NCLEX program.
Yeah.
Now, the good news is, even if you don't do the NCLEX in Ghana, you can do our CNA program. And you take the CNA exams here in Ghana. You will not travel anywhere to take the CNA. When you pass the CNA, we prepare you to write the IELTS. And for CNAs, we accept IELTS general. But for NCLEX, we take IELTS academic. And once you pass CNA exams, we'll file the green cards, and the rest will eventually get to the US. You go straight into a classroom, so to speak, into training when you arrive, prepare and take the NCLEX in the United States so that you can practice as a registered nurse. So it is good for you to be here today. It helps you prepare you to see what lies ahead of you. So Migz, I believe I have captured the overview, what you wanted me to do, correct?
Yes, David.
All right.
Meaning your nurses there will be taking first the CNA if they cannot, because of the expensive finances for the NCLEX in South Africa, so they would take first the CNA.
No.
And they would just take the NCLEX in the US.
Okay, so we have.
If they can.
We have some here who are taking the NCLEX here. We have carefully selected them to do the NCLEX and take the NCLEX here. We'll pay the cost for them to go to South Africa to take the exam.
Okay.
And we selected them based on their performance in the assessment exams and the interview. But there are others who we think will not be able to do the NCLEX here, or have chosen not to do the NCLEX here, or cannot take the NCLEX here. And those ones, they will do the NCLEX when they get to the United States.
Okay. So amazing program. So if they cannot afford, cannot pay for their finances for the NCLEX in South Africa, so they can first get the CNA and just take the NCLEX in the US.
Exactly.
But they need to, but still they need to prepare themselves for the NCLEX. Am I correct,
Exactly.
David?
Yes, that's correct.
Yeah.
That's correct.
So that when they arrive there in the US, they can take the NCLEX soon.
Correct.
Okay.
That's correct.
So yeah, the CNA is just their passport, you know,
Yes.
in working in the US. Okay.
Correct. Yes.
Okay, fine. So amazing program.
Yes.
But those who can afford, so they can right away take the NCLEX. Am I correct?
Correct.
Okay.
And we have some here. We have quite a number of them on this Zoom call.
Yeah. That's why it's very important for us to, you know, to assess them very well.
Yes.
So that, yeah, because of the expenses that they have to prepare.
Exactly.
So they need to be good. They need to, you know, focus on the program so that they could, you know, pass the NCLEX.
Yes.
So same here. Yeah, same here in the Philippines. So we actually paid for the process of the application of the NCLEX. It's so expensive, even the review. That's why they're making good and they always attend their program. So we require them to attend and we require them to do those activities that we are demanding them to do. So with that, of course, they will pass the NCLEX. It's their choice. If you wanted to pass, of course, you have to focus, you have to work hard. Because as you mentioned earlier, David, this is a tough situation that we need to, you know, exert all our best, you know, to pass the NCLEX. So we need to do something. It's not only within the program, but it's you guys, because you will be the one to, you know, to take the NCLEX, you know, to work hard. But everything should, you know, always work hard to, you know, to be happy at the end.
Yes.
Even though, yeah, even though it's, you know, very hard, a hard situation, not only for the time, okay, our, especially in studying, and of course the money also, right?
Yes.
Uh,
Yes.
Okay, so I would add on, guys, where the David's presentation about the programs, as you can see there. So what we're doing in the Philippines is the program that we are actually presenting you guys is also the program that we're using here in the Philippines. And as you've seen on you have seen on the last part, so the predictors, you can see the reinforcement phase. So after taking the predictor, so after the end of the program, you need to take the predictor. So the last part, David, yeah, this one. Okay, so after uh, the programs, all of this topics here ended, we'll be giving you an evaluation. We call this as predictor. And after taking the predictor one, we'll be seeing your learning opportunities. And as you can see there, we have reinforcement coaching. So I will be the one to do reinforcement so that we'll be able to know or to assess whether if you can you're able or if you can pass the next predictor. So we'll be reinforcing you about your learning opportunities there. Like the content of the predictor is the NCSB and test plan. Like we have safe and effective care environment that includes management of care and safety and infection control. We have basic care and comfort. We have reduction of risk potential. We have physiologic adaptation. Under that, we have basic care and comfort, reduction of risk potential, pharmacological and parenteral therapies. And we have psychological adaptation, health promotion, and maintenance. So those are the content of the predictors. For us to know if you have learning opportunities on those content areas of NCSBN. Say, for example, your weakness is on management of care. So I will be reinforcing you guys about management of care. So meaning you need to join the invite. So it is even face to face, even online, you will be seeing me and I will be seeing you also to give you a reinforcement. Okay? Is that fine with you guys?
Yes, I think so.
Okay. So, and that would be fine to you. Okay. So now after that, so we will be giving you another predictor. That is the second predictor. And it depends on your performance on the predictor too. So still I will be enforcing those learning opportunities based, as I've said, based on the NCSBN test plan. Like say for example, as I've mentioned, if you are weak at management of care, of course you need to work on that. So I'll be giving you an activity, additional activity to test most. Okay, so to reinforce your learning opportunities on that area. And let's say if you have problems with pharmacological and parental therapies, okay, so of course I will be giving you also an activity to reinforce yourself so that during the next predictor, we'll be seeing already if you have improved or not. That's how we do our program here. We make sure that you're able to reinforce those learning opportunities that you encountered during this after completing this program. Is it fine to everyone?
Yep.
Yes, it is.
Okay. So, but of course, I need, guys, so I can reinforce through online. So I need a very good connection. And I need that I need you guys that you can hear me clearly so that when I present those test drills reinforcing your learning opportunities, you would be able to understand what I'm saying, and I will be able also to hear you hear your questions or comments or your thinking about that concept. That's how we measure our nurses before taking the NCLEX. Especially right now, so we have the NGN, the new generation NCLEX. But no worries about that, guys, because even though it is a new generation NCLEX, it contains only 20% NGN and 80% traditional, meaning to say the former type of NCLEX that was given before is still the same, and just 20% for the case studies. Okay, so could I present that, David, after
Sure.
this?
Sure.
Okay.
Let me stop. Okay, go ahead, share your screen.
Mhm. Okay, for a moment, I have to connect my screen.
No problem. Take your time. Okay, so whilst we wait for Migz, I'm happy to also inform all of you here. You know our program, those who have started the training, those who have been enrolled on the training, You know, we meet every Saturday at 2 p.m. Every Saturday at 2 p.m., a compulsory gathering where we discuss your progress, challenges you face, and specific topics. Coming Saturday, that date should be, 1 second, on the 13th. On the 13th of May, this very Saturday coming at 2 p.m., we will be hosting Patricia Frempong. Now, Patricia Frempong is a CNA, a Ghanaian CNA that is working with that is working with United Methodists, your future employers in the US. She's going to share her life journey, her story, her ups and downs, and how the work is like on the US side when you eventually arrive in the United States. Now, most of you here know Patricia Frempong. A number of you here who don't know her, but she's a Ghanaian nurse in Ghana and left Ghana to go and live in the US and work. She has agreed to talk to all of you to share her experience and her life story with you. So come Saturday, both NCLEX and CNAs, we invite all of you to our usual Saturday section at 2 p.m. Ghana time. That will be 9 a.m. Chicago time. She has agreed to join us. Now, when Patricia is done on Saturday, coming Saturday, Migz, please let me know when you're ready. And Patricia is done coming Saturday. The following Saturday, that is the next Saturday, another Ghanaian who is also currently in the US and working with United Methodists. She's called Grace Bedu. Now, remember I said Patricia is a CNA, Certified Nurse Assistant. Grace Badu is a licensed practical nurse, an LPN. She used to be a CNA. Today, she's a licensed practical nurse. And she has also agreed to speak with all of you the following Saturday. That is on May 20th. On May 20th. Then the following Saturday after the 20th, which is on the 27th of May. On the 27th of May, another Ghanaian, a nurse who is also working with United Methodists in the US, will also address you. She is called Agnes Amuakwe. Agnes Amuakwe. She is also a nurse, but a licensed practical nurse, an LPN. Then the last Saturday, well, okay, so 27th is actually the last Saturday in May. Then the next Saturday, which is on the 3rd of June, June 3rd, another Ghanaian who is working with United Methodists in the United States, Martha, will address all of you. Coming 3rd June. Hi, Migz, are you there? Okay, Migz seems to be on.
Okay, yes. Hello, David. Can you hear me?
Yes, I can hear you.
Okay, for a moment. So I'll change my screen, please. Okay,
All
for
right.
a moment.
Okay, go ahead. So let me know when you're ready. So, my dear brothers and sisters, we have a series of programs lined up just to prepare you to hold your hand to go through this program to eventually get to the US. And then you're going to have a fair idea of what the work is like. Ghanaians who are working with your future employers, bearing their testimonies of what they see and what they go through every day. You'll have the opportunity to ask them questions. Okay, engage them, learn from them, so that you prepare yourself psychologically. This will settle you down. There are many of you who are unsure whether to even start the program. There are many of you who have started the program, and we are sincerely grateful to you. But there are quite a number of you who are also unsure to start the program, whether or not. And there are many voices out there. And sometimes when the voices are that many, it can be a little bit confusing making a choice. We want to make it easier for you to choose. And so we have lined up all this program just for you. So let me go over whilst Migz finish a setup. Coming Saturday, May 13th at 2 p.m. Ghana time, Patricia Prempong Amponsa, many of you here know her, will address all of you. She is a CNA with United Methodist. Then the following Saturday, Grace Badu, a licensed practical nurse, will also address you. Then the third Saturday from today, Agnes Amoa Koi will also address you. Then on the 3rd of June,
have 2 new WhatsApp messages.
On the 3rd of June, one more Ghanaian, Martha. Martha has an inspiring story. She will share that with you on the 3rd of June. So don't miss any of the Saturdays compulsory Zoom sessions. Don't miss. You will miss too much. Okay. All right. So Migz, I see you are ready now.
Okay, yes, David. Can you see my screen, guys?
Yes, we can. Go ahead.
Okay. So once again, so welcome to Aguinaldo Recruitment Agency. So this is our NCLEX review orientation. Okay, it was already presented. The program was already presented by David a while ago. So I just want to present to you guys our new generation NCLEX examination. Okay, so I think my screen is not moving for a moment. Okay, yes. Okay. Once again, guys, good morning, everyone. Are we all good? Ready
Yes,
to?
we are good. We are
Okay.
good. We are good.
Okay.
Let's go.
Thank you. Okay, so actually, this is the flow of our program. Our NCLEX program, seamless integration are the following. As you can see here, we have the knowledge, we have the skill, we have the attitude. Of course, the knowledge are the concepts that we have learned from school during our nursing days, when we studied nursing before we take your licensure examination. Okay, so it's just a review. So meaning to say, we review all these concepts that we learned from school, our nursing school, but then since we'll be taking the NCLEX, so we need to learn those task-taking strategies. So this is the skills that we're referring to. So we use not only practicing yourselves to answer those questions for NCLEX, but also, guys, to know those or to apply those test taking strategies to choose the best answer. Okay, so we have a lot of strategies that we can use to choose the best answer. And of course, we have here the post-training enhancement. Of course, your attitude is needed, badly needed. Why? Because you need to focus. You need to prepare yourselves. That's why I mentioned earlier, it's up to you. If you really wanted to pass the NCLEX, of course, you need to focus on. Okay, if not, it's your choice. But then we need to have these 3 components for you to receive your license. This is how we prepare our nurses. Now, so our NCLEX program is a predictive approach because we always give pre-diagnostic tests. Before we start with the review, we need to see first your learning opportunities, how far you have understood your nursing concepts and how you were able to apply that in the real situation. And we have here the comprehensive review in accordance with NCSBN curricular framework. Meaning to say, guys, the video lectures that we'll be presenting to you are based already in the NCSBN curricular framework. And it is a computer adapted test, and there are test rationalization after the post test that will be given to you guys. And we have the simulations. Okay, as we mentioned before, after completing the program and before you will take the actual NCLEX, you will be given a lot of tests, a lot of simulations like endurance test, where the endurance test that we are referring to are tests given to you to build your stamina and strength for you to stand the pressure when taking long or encountering long number of questions. Like now, the maximum number for NCLEX is 150 items. If we will be giving you an endurance test of 265 items, that would help you guys to build your stamina and strength so that in the actual NCLEX, you will not experience any pressure at all. Okay, because you're already used to answer that great number of questions. Okay, now we have this one-on-one coaching. When we say one-on-one, we will be telling you guys your learning opportunities. So we have a tool that we use to measure your competency, to measure how far have you understood the concept, how far have you understood to apply in the real situation. Okay, so this is the Flow Bar NCLEX program. Okay, and we mentioned earlier, so we have the following content. We have the intensive review through the video lectures that was given to you guys. That will be given to you. We have predictors. And then after that, as I mentioned earlier, after taking your predictor 1, we will be giving you reinforcement for you to move on to predictor 2. And then after that, reinforcement again to for you to move on the 3rd predictor until you reach the predictor 4. And after reaching the predictor 4, we will be giving you a lot of reinforcement also before we will be giving you post-evaluation. And then after that, before taking the actual NCLEX, we will be giving you final predictor. Okay, for us to know if you still need reinforcement or if you are really ready to take the NCLEX. Okay, so here, what we're doing, so we have, of course, we're checking, we have daily attendance, checking. So, of course, attendance is a must. Of course, as we mentioned, for us to immediately finish the program and pass the NCLEX, of course, we need to attend. Okay, we need to focus. And, of course, we need to complete those administered test drills and scheduled post-test. So, I have prepared here the following scores. So, of course, the passing score, we have 75 items, but we consider 54% for the post-test for the beginning, okay, percentage. Meaning to say, we started with 54% until we reach 75%. It is acceptable, but it's not acceptable if you gain less than 54%. Now, for predictors, of course, you're completed. After completing, as I've said, those topics. So we'll be giving you predictors. Okay, so that will be able to know if you're ready you to face the challenges that lies ahead of you. So we started with 56%, of course, onwards until we reach 75%. So that at the end of the predictor, so that is predictor 4, so we'll be able to meet the 75%. And in that case, we are ready to take the NCLEX, and we will be giving you pre-boards. Some of our nurses here experience and encounter difficulty in taking our pre-boards. That's why, so we taper down to 60%. So that's the beginning of the pre-boards. This is actually the lowest percentage that we can give, but we still need to reinforce them, to give reinforcement, so that will be able to beat the 75%. Okay, this is how we screen our nurses. Okay, so we started with 75% for the post-test, predictors of 76. For the first predictor, until the fourth predictor, they will reach the 75%. And if we will be giving them pre-boards, so we accept them for 60% until they will attain or reach the 75%. Okay, so of course, for us to prepare ourselves to take the NCLEX, of course, we need to be prepared. Always arrive early and take a moment to relax. Listen. We need to listen attentively to our instructors. Listen to the instructions given by our instructor. And guys, take note, if our session is ongoing, please start to turn your microphone on mute. Okay, and if you have questions, so you can raise your question at the end of the discussion. So we'll allow you to ask question at the end of the discussion, but you're just going to raise your hands or write your questions on the chat box. And please turn on mute your microphone. But if you just turn on mute if we are allowed you to talk, guys. Okay. Now, so the test was that we'll be giving to you guys. So we will be giving you test login credentials. So we'll be providing that. So, but don't forget to write your last name first before your first name. Like here, an example, we have the family name here, or the last name is Bobby's, first name is Chill, or last name is your last name David. Okay, before. Okay, David. Okay, and yes.
And the first name is Ado.
Ado, yes. Ado, yes. Okay,
then,
comma, and then
then David, yes.
Okay. So we need to be strict on that because, guys, and the actual NCLEX, you need to read first the instruction. Understand the instruction first before you start. Do not in a hurry in starting. Do not be so excited, to take the exam immediately. So read first the instruction. Okay, and then once you are able to open the link, just enter the passcode. That's how to answer the test most. And of course, it says here, read the test directions very carefully and watch for details. Plan how you will use the allotted time. Answer all the questions on the specified time. Because later, guys, at the end of your intensive review, okay, before we give your predictor, we'll be giving you guys evaluation, which is a time pressured exam. Like say, for example, 150 items is just for 15, 150 minutes. 1 minute per question must be allotted. So if we will be giving you time pressured exam, of course, you need to answer all the questions on the specified time. And then failure to follow the rules, the result of your test will not be considered, because especially if it is a time pressured exam. And the actual NCLEX, of course, you need to finish your exam on the specified time, because if you fail to finish that on the specified time, so of course your test will not be considered. Okay, so I think our microphone is not muted. Okay, so those who are listening,
yes,
you turn
just
your
muted
microphone.
it. Sorry about that. Just muted it.
Yeah. Okay, so that's our, of course, we need to keep ourselves calm and pass the NCLEX. Okay, later question. Okay, before that, Okay, so now, as I mentioned earlier, okay, so we are already in new generation NCLEX. So what should I expect? What would you expect, guys, for the NGN? Okay, so let me present to you. Okay, so this 2023 NCLEX RN test plan. Okay, so for registered nurses. So it is a framework of client needs. The framework of client needs was selected for the examination because it provides a universal structure for defining nursing actions and competencies and focus on clients in all settings. And the details of next generation NCLEX will tell us the length of the exam will be slightly different from the current NCLEX. Now, the NGN presents 70, I should say, to 175 scored items, depending on the ability of the examinee. So every candidate will have to respond to 3 case studies, each presenting 6 items that are designed to assess clinical judgment competencies. And this adds up to a total of 18 clinical judgment items that every candidate will answer a minimum of 52 knowledge-based questions. Therefore, if we complete the NCLEX or using the algebra, so we have 18 clinical judgment items for 52 knowledge-based items. That's a total of 70 items. And the examinee will also be asked 15 items that will not be scored, that will be used for future item development. And the maximum number of questions will be 135. And after the minimum number of items are answered, now if the candidate is still testing, the NG and standalone items will be included. So now, with that, those I mentioned earlier, why make changes? The reason why it changed to NGN, because there's a gap in education to practice abilities. As you can see here, so this is the education, so 50%, and the application, or meaning to say, when we are already professionals, we are already, after passing our local licensure examination, if we are already registered nurse, we only, guys, apply the 65% of the knowledge that we learn in school. That's the reason why nurses are actually measured based on how they would take care of their clients. That's why they will be given case studies. Like you will be. It seems like you're already working in the area in the hospital, that you will be given a client. You will be admitting a client with that condition. Okay, and what and when? Okay, the engine started. So actually, it started last April 1. It started already, not only for the RN, but also the PN or practical nurses. As we mentioned earlier, okay, so the maximum number is 135, 70 minimum, and to 135. But as you can see here, we have 85 to 150 questions. Why? Because it includes 15 experimental questions. So 15 experimental question is not scored, only the 70 to 135. So again, the 15 question is not scored. And we have new case study format introduced. So as I mentioned earlier, the 20% for the NGN and 80% for traditional. So this case study format is being asked on the first 20%, the first actually on the first set, like the first 70 questions, and there will be opportunity for some partial credit scoring. So this is actually, good for the new NGN, because how does scoring work during the NGN? Okay, so we have the following scoring rule. Okay, we have here plus over negative. So meaning you need to earn 1 point for each correct selection and forfeit 1 point for each incorrect selection. Like in select all that apply questions. Like say for example, you will be you have 4. Okay, so you have 4 choices, and 4 choices, and you have 3 correct answers, and you have 1 wrong answer.
Mhm.
So 3 minus 1, so you have 2 points.
Oh,
Okay, this is what it means. Yes. So earn 1 point for its correct answer. You still have, unlike the SATA in on the traditional, if you got wrong one, let's say the answer for the SATA is, let's say 3, and you got 2 correct answers only, and you miss or you have incorrect for the third one, so that will be already considered as wrong. Here in the new generation NCLEX for the NGN, so you need to earn 1 point for each correct selection and forfeit 1 point for each incorrect answer. So meaning to say you still have chance, of passing because you still have points.
that's right.
It's not always considered wrong.
Yeah.
And we have the 0/1 scoring rule. So you need to earn 1 point for a correct response and earn 0 points for an incorrect response. No partial credit. Example, for option multiple choice. So there's no partial credit, but you need to earn in multiple choice. And we have here rational scoring rule. So earn full credit when elements of a linked pair of concepts are correct. Requires understanding of pair information like the cause, the effect, relationship. Example during sample type is in the drag and drop rational. Like the client accessories for developing. So that's the cause due to. Okay, so signs and symptoms. You need to, of course, to be correct in the cause. Okay, so even if your the signs and symptoms is incorrect, you still have 1 point because you know the cause. But if your cause is wrong and effect relationship or the signs and symptoms or the effect is correct, still that is considered wrong because you don't know, okay, the cause. Okay, so you need to know first the cause. Okay, how will the NCLEX look? So as I mentioned earlier, we have we need to think the 80/200 rule. 80% of the test is more on traditional questions, and 20% of the test contains case study formats that contain sets and standalone. Okay, what is a set? Okay, so we have 6 questions that relate to an unfolding case study as I mentioned earlier. The case study will be presented during the first 70 questions, and sets will only occur in the first 85 questions. As I've said, 70 questions, because the 85 questions actually is not scored. The 70 questions are scored. And student will receive 3 6-question sets in the first 85 questions. Okay, and 1 set on the first third, second third, and the last third on the first 85 questions. In addition, on the first experimental questions, the student may receive sets, standalone, and traditional. So meaning to say, you can already familiarize yourself for these 15 questions before you start with the actual question that will be scored. Okay, so yeah, even if you feel anxious that time, it is the best time for you. Actually, this question not only for us to to test, to be familiar with the setup, to be familiar ourselves on the testing center, but also to familiar ourselves with the question that will be encountering after the 15 questions. So this is a very good guys trial for us before we answer those questions that will be scored. So we can get familiar to it. We can decrease our anxiety after encountering these 15 questions. Okay, so what does a set measure? Okay, now so the set measure is about clinical judgment. These are about clinical judgment model, like the first 6. Okay, so these are the following question. We need to recognize cues. Okay, something is concerning, not expected. And then after that, we need to analyze cues. What could it be? And prioritize hypothesis. It is most likely this, or I'm concerned about this. and we have to generate solution. I need a plan to address what I have identified. 5 of 6, we have to take action, implement the intervention from AD plan, and of course, evaluate. So meaning to say, this is the application of our nursing process as nurses. You need to assess first, you need to analyze, you need to identify the problem, and you need to prioritize, of course, the client's problem, and then you plan, okay, for the needed intervention. What would your action based on this problem? And then after that, you implement those actions, and then of course, very important for us to evaluate. These are the following content of the set, okay, examination. Okay, during the first, as I've said, 70 items based on clinical judgment measurement model. They would be able to, the reason why, as I've said, it was embedded in this new test plan because we are tests how we could take care of our clients in the real situation and the real scenario if you are admitting a client. Okay, that is for the set. Now, what is a standalone? So standalone presents a case study but with only one question. A case study, and then, okay, so, and you will be given one question. Format is either as a bow tie or trend question. So this is an example of standalone, presenting a case study. Okay, so this is a case study based on the nurse's notes. That's why be familiarized, guys, with your, again, your electronic health record. It contains the nurse's notes. Later on, we'll be sharing other contents of, okay, the health record. Yeah, so if you will be given here a case study, so this is the condition of your client, and you will be given one question only. But you need to, you're just going to take this one to choose the answer here. So another one we have here, a trend. So this is a standalone question, a case study attached to one question. So like this one, need to recognize the trend and the tabs and tables, then answer a question. Example, what's going on or what should the nurse do? So this is the question, and you are just going to, okay, check the answer based on, okay, the choices that we presented based on the case study. Or, so this is a trend type, and or we have this bow tie. Okay, so the bow tie, so it's like drag and drop before. So in drag and drop, in the traditional, you're just going to drag your answer from the left side going to the right side here. So there is an upper box here that you're going to, okay, so to fill in based on the question. Okay, you answer first, the first box based on, okay, the choices are below the table, and okay, your answer for the middle box is based also on the table below. Okay, so this is an example of the bow tie. And we have here a sample of our electronic health record. We have the nurse's notes, history and physical assessment of laboratory results. We have imaging results. We have orders, flow sheets. Okay, and here, that's an example of the electronic health record, the health history. So the case study that will be presented to you guys will be based on, okay, the electronic health record. If it is on the nurse's notes, okay, the reference on the nurse's notes, the doctor's order, history, physical assessment, laboratory test, imaging. Okay, so these are actually just example of the electronics health record. Okay, the flow sheet. We have laboratory results. Okay, with regards to no problem, with regards to references of the result of the laboratory test, because we have a reference range here for the case study for the 20% NGN. But actually, guys, still you need to, okay, remember, you need to still memorize the normal values for those laboratories, because you will not be given reference trains in those 80%, okay, traditional. But in the 20% NGN, you'll be given reference trains that you can refer the result. Okay, we have the imaging, so the result of the diagnostic test. Okay. Now, as we mentioned earlier, there are currently 5 assessment categories that are used for the unfolding case studies. So we have the highlight, okay, multiple response, drag and drop matrix, and drop down. So within those categories, so live variation of it, summing to a total of 12 items. Currently, there are 2 standalone items, item types, and we have trend and bow tie as I presented a while ago. Okay, but I just want to present to you all current NCLEX item types plus here, okay, plus the traditional. So we have extended multiple response, select all that apply, select in, multiple response grouping, clause, we have rational for drag and drop, we have highlight in text or highlight in table. We have matrix grid like multiple response, multiple choices, and we have drop down the clause, rational in table. We have the bow tie, we have the trend. Contain in trend, it can contain all new item types except the bow tie. Okay, the bow tie, we have seen a while ago. The example, we have 3 columns there, and we have 3 boxes at the upper portion of the column. Oh, that's the bow tie. So except the bow tie for the trend. Now, when answering highlight text, okay, so you're just going to click to highlight the findings that would indicate the client is not progressing as expected, like this one. If a nurse's note is being presented and you ask question about highlighting, of course, you're just going to click your cursor to highlight those findings that indicate the client is not progressing as expected, like this one. So you're just going to highlight, like say, for example, the question here is the client is not progressing as expected. So after splenectomy and can ambulate with minimal assistance, the client is refusing to use, refusing to use spirometer, is stating it caused left-sided chest pain. And another one that progressing here, intermittent nausea with some vomiting. Okay, and okay, utilizing prescribed patient-controlled analgesia. Okay, so you're just going to highlight those statement that the client is not progressing expected, like can ambulate with minimal assistance. The client is refusing to use the spirometer, stating it caused left-sided chest pain. The client is utilizing prescribed patient-controlled analgesia device maximally every hour and continues to have intermittent nausea with vomiting. So those are those statements signifies that the client is not progressing as expected. This is how we're going to highlight. Okay. So another question here for highlight text. Okay, so like click to highlight the 3 orders based on the doctor's order. So you're just going to highlight 3. Okay, so it's up to you if we're going to highlight all. So, but the question is asking for only 3 orders. Okay, and we have also highlight table. Yeah. So this is an example of highlight table. So, okay, so it is the data is presented in a table. Like question here, click to highlight the laboratory results in the table consistent with bacterial infection. So, what laboratories we have? Okay, so we have WBC 14,600. That signifies that the client is having bacterial infection. Okay, and we have multiple response. This item sets up a question asking the examiner to select all that apply. A set number or a grouping. Up to 10 answer options may be presented with partial credit allowed for correct answers. There may be only one correct response or multiple correct responses, but the candidate must select at least one option. Okay, example of select all that apply. Okay, here, which finding indicates that this patient has impaired perfusion? Select all that apply. So you are just going to choose. Okay, which statement here describes that the patient has impaired perfusion? Okay. Okay, so another here, example of select N. Select for findings that require immediate follow-up. Okay, so based on the class vital signs, whatever lung sound, so you are asked to select 4 findings. So another we have here, the grouping. For each body system, you need to click to specify the potential nursing interventions that be appropriate for the care of the client. In each body system may support more than one potential nursing interventions. And each category must have at least one response option selected. So this is an example of grouping. Okay, so as you can see here, we have the body system based on the different system that you need to know what body system is being affected and what are those potential nursing interventions. Now, if the respiratory is affected, so you're just going to highlight the following. Okay, based on the body system adaptation. This is an example of grouping type of question. Okay, so another we have here answering clause items. Okay, what is a clause item anyway? Okay, so fill in the blank item. Words are removed from a sentence or sentences and replaced with spaces. You select the best word or phrases to fill in its space. Like we have here 3 types of clause items. We have clause drop down table. We have clause drop down rational. An example of each type, including how each type of clause item is scored, and tips of how to answer this NGN question types. Okay, so this is an example of clause drop down. Okay, so this is the question and you are just going to select on this arrow and you fill in this blank. And then as I mentioned earlier, you need to know the cause and the priority for the nurse to request an order for. So this is your action, or sometimes signs and symptoms is being asked. So you're just going to, okay, your second answer here would be based on your first answer. High risk of death is, okay, and priority. So you answer your answer in the second blank here will be based on your first answer. Okay, like an example, this is just an example. Okay, risk for, let's say, malnutrition, yeah, priority is, it depends your answer. Okay, you're just going to choose your answer. Okay, and we have the drop-down table. As you can see here, as I presented a while ago, we have systemic adaptation here, body system, if the respiratory is affected. So what will you choose? What are those potential nursing intervention based on the respiratory problem? Okay, so this is an example. If these are the following potential nursing intervention, you are just going to select and fill in this blank. Okay, and we have here the drop-down rationale, as we mentioned earlier. You need to know the cause as evidenced by manifestations in. Okay, make sure to select the best answer for the cause before the signs and symptoms. But you need to answer everything. Okay, that's an example. Okay, and this is the second one. So if our priority concern for the class is dehydration, as evidence by what are the class manifestation, or based on the following: electrolyte, fluids and electrolyte balance. So you need to select, and then after that, so not only the following here, and you need to choose again what would be your other answer here on the third box. Okay, so later I will discuss this down later. So I'll be presenting to you. Okay, later. Okay, the scoring. And then we have here examples of matrix of grid questions. We have matrix multiple choice, 2 column or 3 column options. We have matrix multiple response. Okay, so this is based again, guys, on case study at the electronic health record as I presented a while ago. Okay, that will be based on health history, nurses notes, vital signs, laboratory results, orders, flow sheets, okay, imaging result. Okay. Now, this is an example of matrix multiple choice, 2 columns. Okay, so here, okay, make sure to answer guys, the following columns. So this is your assessment finding. Okay, what are those assessment findings that you understand and needs further teaching based on the statement above? Okay, so here, you need to fill in. You don't have answer in the first column. Instead, you answer your answer is on the second column for the first 2 rows. On the third row and the fourth row, you choose your answer on the first column here. Okay, so meaning we're able to answer everything 1, 2, 3, and 4 rows. You need to answer all the rows. You are not allowed to miss. Okay, so first row, you have 1 answer. So your answer is in the second column. The second row, you have also 1 answer. Okay, but your answer is in the second column. Okay, make sure that each row must be answered, because you will not be able to continue to the next question until responding to all the rows. Okay. Now, so this is how being scored based on our matrix multiple choice. Okay, so here, if you got correct on your first row, okay, so you will be given 1 point. And you got incorrect during the second row. Okay, that is 0 points. And you were able to gain correct answer during the third and the fourth. That is 1 point, 1 point. So you have a total of 3 points. Okay, so you have a total of 3 points, 1, 2, 3. Okay, so because you have incorrect answer. So this is good for you guys, because okay, your incorrect answer was not deducted, was not considered incorrect. So you still have points here, 1, 2, 3. You have 3 points. You gain 3 points. So this is the 0/1 scoring model. The scores for the rows are summed together to get a total score for the item. So meaning to say you have a total score of 3. Okay. Now, so another example for okay, we have here the 3-column matrix. But take note, guys, for both the 2-column and the 3-column matrix, multiple choice item type, each row should be treated as its own multiple choice question. That's why you need to answer. Okay, you need to answer all rows. Okay, like here, row 1, so you have 1 answer here. You're able to answer, but your answer here is okay on the 3rd column. So for second row, you were able to answer also the 3rd and the 4th. As we mentioned earlier, you cannot proceed to the next question not unless you're able to answer those columns. Okay, so now, so we have here scoring matrix multiple choice, 0/1 scoring rule. So the raw score scored independently with the 0/1 scoring model. So the scores for the rows are summed together to get a total score for the item. So like here, the first column, you have incorrect answer. Second column, you got correct. Third column, you had correct. And the fourth column, okay, you have incorrect. So you have 2 total points because you have 2 correct answers. Okay, so this is just an example of NCLEX questions. Okay. Now, so scoring the matrix multiple response test item. So we have plus over negative score rule. So like say, for example, you have column 1. For the column 1, you have 4 points. 1, 2, 3, 4. Okay, so you have 4 points. Column 2, you have 3 points. And 3 correct answers and 1 incorrect. So you have only 1. Okay, you have only 2 correct items. So because 3 minus 1. And the third column, you have 3 points. So no incorrect answers. So you have a total of 9 points. Okay. The other one a while ago, so you 0 is, so they will be only counting your correct responses. Here, so they're going to deduct your incorrect answers from your correct answers. Okay, finally, the matrix multiple response grid, you do not get penalized for not selecting a correct answer. You only get penalized for incorrect answers you have chosen. So you mentioned a while ago, if you have 4 correct answers and you have incorrect, of course, they're just going to deduct it from your correct answers. So 4 minus 1, you just gain 3 correct answers. Unlike the 0/1, okay, so no deduction. Okay. Now we have also here highlight text as we presented a while ago. So you're just going to highlight. So this is an example of to highlight the text. Okay. So that's how we're going to highlight the text. Okay. So highlight table. Okay. So this is an example of highlight table. Okay. So here or answers. This is how we're going to answer for highlight table. Okay, to answer enhanced hotspot items, again, it's like highlighting. Okay, so in case studies. That is answer enhanced hotspot items. Okay, so how are highlight items scored? Yeah, scoring is okay, plus over negative scoring is used for 3 question types. Okay, your plus negative scoring will allow you to receive 1 point for each correct option selected. For each incorrect option you select, 1 point is deducted. It's like we presented a while ago. So if you have 3 correct answers and you have incorrect, so that incorrect answer will be deducted from your correct answers. So we have the total correct minus the total incorrect. But the minimum number of points for a question is 0. In other words, you cannot receive a negative score, even if you select more wrong answers than correct options. Okay, no negative. Because if it's negative, of course, you will fail. Okay, the computer will stop. But if it is 0, so if you will still be given a chance. Okay, so okay. So we have here types of extended as I presented earlier. select all that apply, multiple response grouping. Examples of partial scoring for these items are presented a while ago, and the scoring system also. And as we mentioned earlier, okay, so you will be given case studies and question sets for the first 70 items or 85 questions. So we'll be given questions 1 to 6. That's the content of the NGN. Okay, so any question, guys? So that's the end for the NGN. Hello.
Hi, I'm here.
Okay, so any question, guys, from the audience or nurses?
Faustina, do you have any questions? Do you get it so far? Frederick, Efia, does anybody have any question? Daniel?
Yeah, that's the information for those who are really wanted to take the NCLEX. So
right.
This is how they're gonna prepare themselves, so that they would not they should be expected from them how to answer those different types of NCLEX questions.
Thank you very much, Migz, for that in-depth presentation.
Okay, you're welcome.
Guys, you have the picture right in front of you, so you see what preparation you need to go through to be able to write the NCLEX and pass. Okay.
Yeah.
I see most of you are commenting, very insightful. Yeah, thank you for that. A lot of comments on the chat page. That we are all good. Yes, yes, yes. Okay, that's nice. Thank you guys for your response. Okay, so Migz, I think we are good. If there is anything to add, you can. Otherwise, I think we've covered all the basics. We'll have a plan. Some of them have started the training. Sorry, there's a question here. Please, can we be given the slides to go over? Thanks. Yes, yes, yes. We're going to share. We're going to share the recording after the meeting. Mark, your hand is up. Do you have a question to ask?
I think Mark is raising his hand.
Yes. Mark, your hand is up. Do you have a question? Okay, Mark seems not to be hearing me. Mark, if you can hear us, please post your question in the chat box. George, were you saying something? George, were you saying something? If you have something to say, you need to unmute your microphone and speak. Okay, I don't think Mark has anything to say. All right. Hey, John Ofori, it's been a while. Please get in touch immediately after the meeting. I need to speak with you, John Ofori. All right. Okay, so I think we don't have many questions now. I believe we're going to prepare ourselves, continue the review, the training, and then as we go along, if you have any question, you share it on the page. We'll get Migz to respond if there's a need for it. Okay. Migz, thank you very much for your time.
Okay, so you're welcome, David. When would be the actual start of their program, of the review?
Well, we started last 2 weeks ago.
Oh.
Those who have started are still at just the introduction phase. Just a few students are currently on the management of care phase. So as we go along, if we have any questions, we're sure to call upon you to assist.
Okay.
All right.
Okay.
Right.
Don't hesitate to ping me, David. So if you need help, so just tell me in advance.
Sure.
Okay.
Thank you very much, Migz. It should be around 6 p.m. in the Philippines now.
Yeah, it's almost 6:30 here.
6:30, yes, it's 10:30 here. Thank you very much for all your contribution, for coming. Thank you for spending your first hours in the morning with us. We'll continue now. Let me repeat the announcement I made earlier. I said, you all know, those of you currently on the training, we meet every Saturday at 2 p.m. Every Saturday at 2 p.m. we all meet to discuss the week's program, the previous week's program, your assignments, and so on and so forth. Now, in preparing you adequately, both psychologically and in skills, we have organized special engagement with Ghanaians who are currently working with your future employers in the US. So come Saturday, that is May 13th at 2 p.m., we invite all of you to engage with Patricia Amponsa Rampong. Patricia is a CNA, a Ghanaian, who is currently working with United Methodist, CMSS, Chicago Methodist Senior Services. Okay, she's going to share her experience, processes, what she went through to leave Ghana, to go to the US and work with United Methodist. So this Saturday, 2 p.m. Then the following Saturday, which is on the 20th of May, another engagement with another Ghanaian called Grace Bedu. She is a licensed practical nurse in the US and currently working with United Methodist, your future employers. She will engage all of you on the 20th of May. Then the following Saturday, the 27th of May, another engagement with Agnes Amoa, also an LPN with United Methodist. Then on the 3rd of June, that is the following Saturday, on the 3rd of June, the last Ghanaian to engage you, Martha. Martha will be engaging you. She has an inspiring story to share with you. When you hear your fellow brothers and sisters working in the US, especially working with United Methodist, your future employers, I'm sure it puts the program clearly, settles you down and help you plan psychologically for your transition. Make yourself available. On that note, thank you very much to you all. Migz, thank you. Thank you all.
Okay, you're welcome.
Right. Bye-bye to you all. Bye, guys.
Bye-bye.
Bye. See it again.